2 weeks, COVID cases and hospitalizations are up due to the highly infectious BA.5 variant.
Early in the pandemic, the theory was that if someone was infected, they were immune, at least for a while.
But a growing number of people are getting reinfected with the virus more than once. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us for his weekly visit. Hi, Dr. Pothof. Good to see you.
Good to see you guys.
So BA.5 is now the dominant strain in the country, and it is highly immune evasive. What does that mean exactly?
Yeah, so as these viruses evolve, they usually get better at two things. One, they become more contagious, so they're easier to catch. And two, they're better at evading our immune protections. So what that means is that someone who has either been vaccinated and boosted, or maybe they've recently had COVID-19, maybe back in the spring, if they come in contact with BA.5, it won't take very long for that virus to infect them, and it's pretty likely they'll have some symptoms, mild to moderate. Now, the good news is we don't seem to be seeing a lot of severe disease associated with BA.5, not more than we saw with other Omicron variants, but it is easy to catch.
So how is that affecting then the hospital rates and then people that we're seeing in the ICU?
Yeah, so what we're seeing right now is, in general, hospitals very, very busy, but not necessarily with COVID patients. And the COVID patients that are in the hospital, it's usually pretty even split between those who are admitted with symptoms of COVID and those admitted with other things. But compared to, say, even the Omicron surge in the spring, the rate of hospitalization and certainly the rate of people in the ICU is much lower. So it's more manageable, even though there are probably more cases of BA.5 in the community than what we've seen in a long time.
Well, I think the confusion stems from the fact that people thought, well, if I get vaccinated and boosted, I will have better protection against some of these variants, and that's turning out to definitely not be the case.
Right, so when we first had vaccines available, they were amazing. So against original COVID, which is really no longer on the planet, 90+% effective against any symptoms at all. That was incredible. And now as we have these variants that are much more contagious, better able to escape immunity, that really, based on the vaccines, is targeted at that initial strain, what we'll need to see is a vaccine, which is in the development. They're trying to develop these hybrid vaccines that specifically also target the most common strain. So if we had a vaccine that targeted BA.5, we might get back to something like we originally had, where BA.5 can't even really cause symptoms, but we don't have that yet.
So is that also why we've heard this messaging before, that any type of vaccine or booster is probably going to be a lot like the flu shot, where you have to get it annually to adjust every year?
Yeah, I think that's what you're going to see. And what we need to do is we need to slow down transmission so that when we decide which variant we're actually going to produce the vaccine against, that's the variant that's there when we get the shot. If we produce a vaccine against BA.5, but when we get that shot, say this fall, it's BA.7 or 8, that shot will be less effective.
Well, a lot of people, 50 million Americans, I think over 50, are eligible for their booster, but 1 in 4 have gotten it. That's from the CDC. That's problematic, isn't it? If you haven't received a vaccine, say, in the last year, and you're in that eligibility group, are you at risk?
You are. So the data around that is, for those of us who are like under 50, certainly under the age of 65, if we're vaccinated and boosted with that initial, say, 3-dose series, our likelihood of getting symptoms with BA.5, very, very high. We probably would get symptoms. Our likelihood of getting very sick, not as high. But if you're in that older age group, your likelihood of getting symptoms is still high, but your likelihood of getting severe disease is now higher. So you want to get that second booster to now drop your risk of severe disease back down to where it was.
Okay. Every week.
It's a new
twists
journey.
and turns. I know, just when we think we're getting ahead of it. I hope you had a good vacation. It's good to have you back.
It's good to be back.
Good to see you. Thanks for your time.
Thank you.
We'll be right back.